Hi, welcome back to my channel. My name is Ashley if you're new here, and today we're going to talk all about orthopedic nursing. I got my first video suggestion from, I'm going to leave it here because I don't want to say the name wrong, but they asked me to talk about orthopedic nursing. What is it about? Because a lot of people don't talk about it, or nobody really, I won't say nobody, but a lot of people don't really know what is involved with orthopedic nursing. So thank you so much for this video suggestion. I'm so excited to talk about it. I want to say thank you to everyone who's been watching my videos and my new subscribers. You guys are so greatly appreciated, and thank you so much for watching. So a little bit about me. I've been an orthopedic nurse for about 10 months now. I've worked in a hospital setting, and I currently work in an outpatient setting. If you have any questions about outpatient, being an outpatient nurse versus an inpatient nurse, I have a video on that. You should watch it, and I hope it's informative and helpful to you. But today, I'm going to be talking about all things orthopedic nursing. So if you're interested, keep watching. Okay, so first, I'm going to tell you what orthopedic nursing is if you're not sure, if you don't know what it is. So basically, orthopedic nursing is the prevention and treatment of musculoskeletal disorders. So this can range from arthritis, osteoarthritis, if you need a joint replacement, if you have a fracture, broken bones, if you need steroid injections, anything like that. That's kind of all-encompassing orthopedic nursing. So you can work in the hospital setting, or you can work in an outpatient setting. So in the hospital setting, you're going to see more acute cases. You're going to see patients who are, you're going to see cases that are more severe than you would see in an outpatient setting, because in an outpatient setting, you don't have all the resources like you do in a hospital. So in a hospital setting, you might see like maybe someone was in a car accident and they shattered their leg or something like that, and like they need to have immediate surgery, or I'm trying to think, because I've never worked in like the hospital. How am I gonna put this? So in the hospital setting, you can work in surgery, or you can work on like a post-op unit. And I worked on a post-op orthopedic unit. So that was basically after they had their surgery, they came to my unit to heal. What I did on that unit, in the post-op unit, was we would do neurovascular checks every 4 hours for like once they came on our unit. So we would check their circulation, check their mental status, check their dressings from their surgery, and make sure all that's good. We would educate them on how to keep their body, their limb positioned, whichever limb they had surgery done on. So we would do a lot of education on that. We would do a lot of medication teaching, and you work closely with physical therapy and occupational therapy to help get them back to kind of where they were before, or just start that process, because they say, getting a patient up sooner than later after surgery is very helpful to the healing process. So that's kind of what you do in the post-op side of orthopedic nursing in the hospital. Now you can also work in the surgery area, so you can work in the OR, and that's where they do more of you'll see the actual surgeries happening. And I can't say specifically what surgeries they do. I'm sure they do a lot of the same surgeries they do in an outpatient center. They'll probably do more severe acute cases in that OR than they would in an outpatient OR. So if that makes sense, you're gonna see like more acute things in the inpatient surgical setting. Usually in the hospital, if you're working post-op, you're gonna see that patient they usually stay overnight and then they go home the next day, or that's the plan. But sometimes people aren't recovering as fast, and they're not moving as well as they would want them to before they leave the hospital, so they might stay for like a few more days. And I've also seen more spinal surgeries in the hospital setting and not so much in the outpatient setting, but I could be wrong. So if you want to work in the outpatient setting, it's very different. I currently work in the outpatient setting as an orthopedic nurse. So you do pre-op, which is just getting the patient ready for their surgery. So you'll go over their paperwork, you'll check their vitals, and you put in an IV. From pre-op, they go to the OR, and in the OR, or if you're like working in nursing, this is also for the hospital setting as well. If you're a nurse working in orthopedics in the hospital setting and in the outpatient setting, and you're working in the OR, then you're usually going to be the circulating nurse. And what you're doing is just you're watching everything from the outside, making sure everyone stays sterile, getting, you know, the surgical tech or the surgeon what they need during surgery. You're just pretty much keeping track of everything that's going on, keeping track of billing and stuff like that too. So you're kind of like the helping hands. I know there are some nurses that are certified to do surgical tech, to do what the surgical techs do, but from what I've seen in the outpatient center, surgical techs are helping with the surgeries, and I, the nurse, am being the circulator. So once they're done with their surgery, then they'll go in the PACU. This is normal for both inpatient and outpatient. After the surgery is done, they go to PACU. PACU is where you recover. You're waking up, you're like, oh my gosh, like, what's happening to me? You're not fully with it. So once you're more with it, then in the hospital setting, you'll go to the post-op unit, which is where I worked in the hospital. But if you're in an outpatient center, you'll go straight to the PACU, and you'll wake up and we'll help you recover, make sure you're not nauseous, and make sure your ride is here, make sure we check your vitals for a while, and then we will discharge you home that same day. Outpatient surgical centers are usually same day. Well, they are same day, okay? You have your surgery that day and you're leaving that day. If you're not doing well after your surgery, you will probably be admitted to the hospital. But in the hospital setting, you're gonna be mainly, there in the hospital for like a day. You'll have a little sleepover in the hospital for like a day or two, and then you go home. But outpatient setting, you have your surgery same day and you leave same day. And then also something that's different that I've seen in the outpatient setting for orthopedic surgery is that you do steroidal injections. There's different procedures that you'll do in the outpatient setting, and that's what we call pain. So if someone is having like back pain or I guess any kind of pain, you can do steroidal injections, and that's just like a quick procedure that they do in the outpatient setting that you don't need to go to the hospital for. So yeah, and I've seen a couple of those, and those are pretty interesting. And they do some that are kind of like burning the nerve root, and that's supposed to try to help, get rid of your pain. So there's just a lot that they can do for pain management in the outpatient setting. Just to recap everything, the main difference between inpatient hospital orthopedic nursing versus outpatient orthopedic nursing is that in the inpatient hospital setting, you're going to see patients who have more severe cases and who need to be in the hospital longer, who need to be under the care of a hospital or healthcare workers longer. In the outpatient center, these patients are gonna go home the same day, and yeah, they're not gonna be as severe cases as the hospital. But the job of the nurse in both settings is pretty much the same thing. You're gonna be circulating if you're in the OR during the surgery. You're going to be helping give people what they need, monitoring, making sure everything stays sterile. That's what you're going to be doing in surgery. And then in recovery, you're checking the vitals, you're making sure the patient isn't nauseous, giving them any medications they need, giving them discharge instructions, and then getting them out. So I hope this helped answer any questions you have. I probably missed some questions that I could answer, but if you do have any questions you want me to answer, please leave them down below. I would love to make more videos about whatever you guys want to see and help answer any questions that I can. Yeah, and just leave anything you have down below. I hope you have a great day. I hope this video helped, and I'll see you in another video. Peace. Also, please comment, like, and subscribe if you like what you're watching. Thanks. Bye, guys.